Dr. St. Surin Lord is a fellow of the American Academy of Dermatology, as well as the American Academy of Cosmetic Surgery and the American Society of Dermatologic Surgery. She serves as an assistant professor of dermatology for Howard University, and has been a sought-after speaker at national conferences. She also shares her expert knowledge in professional publications. Voted a top doctor in the DC metropolitan area, Dr. St. Surin Lord's philosophy is that each patient should leave her office feeling better about him or herself. Thank you, Doctor, for taking time from your busy schedule to do this recording with us. What is there on the market for skin tightening and for patients who would like to have a facelift but do not want surgery?
Okay. Nice question. Nice question on the skin tightening, because it's nice that you asked that, because the other thing is with Coolsculpting, a lot of times patients are concerned if they've had children and they have a lot of stretch marks. A lot of times those patients are told, you're not a liposuction candidate because your skin will not snap back because of the stretch marks. Remember, the stretch marks break apart the elastin. And so how I go about that, I say, well, you may have broken apart the elastin, or your skin's elastin broke apart when your tummy or that part of the body stretched, but guess what? We're going to rebuild collagen to help combat that. And collagen, it contracts the skin and it tightens. So we have a wonderful, revolutionary technology that I absolutely love, because it just uses ultrasound technology. The same ultrasound that was used to see a baby in utero, the regular ultrasound, we use it in a method called Ulthera. And you guys may have heard of Ulthera or Ultherapy. And that basically uses heat in the form of an ultrasound to tighten the skin, to tighten the tissues directly under the skin. And so that is an awesome way to tighten skin. Doesn't require a knife, doesn't require anesthesia, doesn't require anything. Because remember, I did complete a cosmetic surgery fellowship, and it was under the tutelage of the amazing and wonderful Susan Obagi. And I did that after having completed 3 years of dermatology residency. And after having done that, when I started my own practice, I actually went totally non-invasive. I did train in facelifts, and I did train in blepharoplasties and liposuction and fat transfers, and those are wonderful procedures. But I found that my patient population really wanted non-invasive, something that they can, keep to their social schedule with, especially in the DC, Maryland, Virginia area. Something that would not change their lifestyle too much, even if it were for a short time. So everything that I tend to do tends to be non-invasive, sometimes minimally invasive. But with Ulthera, it's like getting tissue tightening without needing to actually cut tissue and sew it together. So in terms of lifting, what that does is it also lifts. So Ulthera, it heats, it firms, it tightens, and it lifts. All that with just heated ultrasound. So I tend to call it the knifeless facelift, because you do it once and the results pretty much last at least a year and a half. They last pretty long, and a lot of the ladies or gentlemen who have had it say, you know what, this is great. This is the one thing that's really worked, because we also use it to lift the brow. So anyone who has like a droopy lid, let's say you don't want to get eyelid surgery. Eyelid surgery is definitely a viable option, but let's say you don't want to get eyelid surgery, or you're not a candidate for eyelid surgery. I would do a little Ulthera right here, because it firms and lifts, and that would just lift that lid up without a knife in 45 minutes, sometimes 30, but in 45 minutes. The neck, you can get rid of the loose skin on the neck. Sometimes there's a little bit of skin that's really wrinkly and it hangs, and we see that a lot of times in mature people, or in the chest. When I say mature, I mean like anybody. We used to say like 50s and 60s, but if you've had a lot of sun exposure, you're going to see it in your 30s and 40s. So it's really going to be your lifestyle that dictates when you get these procedures. So we're not going to focus and concentrate on age. We're mostly going to focus and concentrate on how we've taken care of our skin, how healthy our skin is, and what our lifestyle was to get us to these procedures. We're going to modify the lifestyle a little bit just by adding a little sunscreen and getting a little Ulthera done. So to answer your question, what's the latest and the greatest? Ulthera is, and it's affordable, and patients love it. Again, male, female, and you know, young and 40 and over, which is still pretty young, you know, but, you know, 60s, 70s, it's pretty much a wonderful treatment for anyone who needs it.